So we're going to be starting with the thing general mistakes for all the station, which is assessment, planning, implementation, and an evaluation. When you're doing your assessment, you're meant to report, because that's what Osce is about. You carry out your skills, and you are carrying it out. You are doing and you are talking. Basically, you're doing and talking. So as you have your examiner, and you have, if it's a skill that wants you to have like somebody, a live patient. Most of the assessments you have a live patient. Yeah, so if it's the ones that don't need a live patient, like wound dressing, NG tube feeding, you have like a dummy. Yeah, you have a dummy by the side. But once, as you're reporting to your assessor. Most mistake people do in assessment is not reporting. You do your assessment and you report to your assessor. That's the mistake most people do. When you finish your assessment, you report back to your assessor. And as I'm reporting back, so I report back to your patient too. Oh, this is what I did, and this is what I did, this is what I did. I report back whatever finding which you get during assessment. You report back to your assessor and to your patients. Do you get me? So make sure that you communicate. Take communicate and listen to your patients. Whatever they have to say to you, listen. When you're asking a question, when you ask the question, let them answer you, and then you take note of the question. That's what you're going to use in your what's it called? In your observation. Sorry. In your evaluation, and in other stations. Basically, you're going to use it in your planning, you're going to use it in your implementation, you're going to use it in evaluation, you're going to use it basically everywhere in your assessment. Yeah, so in assessment, I've said the first one, which is not reporting back, which is the first mistake people do. Not reporting back, that's not communicating. Another thing is not checking patient ID band. So when you have a live patient, they always wear, even with a dummy, they always wear an ID band. So the ID band tells you the information, details, basically their name, hospital number, allergies, and everything. So make sure you check your patient ID band. Yeah, and if as the patient does have, and the patient has an allergy, you be sure the patient has an allergy band, which is usually red. Yeah, so that's it. So the first one I said about is communication. Second one, checking ID band. And then another thing is not reading what you're supposed to read, the instructions you're asked to carry out, because is what when you come to the station, you have the instruction. If you don't read it, how will you know what to do? So make sure you read before you start any station. Mistake is not carrying out proper personal hygiene. So each station you are doing, be sure to carry out hand washing. You wash your hands. Make sure you know your washing of your hand with five moments of hand hygiene before touching a patient, after touching a patient body fluids, before leaving patient environment, and after contact with patient's belongings. Make sure you know your 5 moments of hand hygiene. Yeah. So another thing is not getting consent from a patient before touching the patient. Before you do the patient, ask the patient, gain consent, and before doing a procedure, ask the patient. Another thing again is not finishing your stations on time. Trust me, no matter how nervous you are, you have to try to finish your stations before your time finish. That's like you have like 1 or 2 minutes before your time. That way, any other thing that you did not remember to say, you say it. But if you don't get to finish on time, and then you have things that you've not said, that's a problem. But if you finish on time, then you remember, oh, you didn't say this, you can easily say it, and then your examiner will mark it for you, depending on the examiner you have anyway. Then another thing again, assessment is not checking patient safety. Before you start any procedure, you have to state it. Your scene is safe to approach, and then you approach. So you need to make sure you state that before you start it. Okay, and also for a procedure like in hospital resuscitation, which is a cardiopulmonary resuscitation, you have to make sure that you state it that your scene is safety for you to approach, and also you remove anything that's going to cause harm in your environment to you and your patient. Yeah. So after that's about the general mistakes. So the next one we're going to be talking about is mistakes that people make in each station, in assessment, in planning, in implementation, and in evaluation. So the first one is in assessment. In assessment, I already said that assessment, what you have to do is checking your vital signs, observations, which is the cardinal points, blood pressure, and the rest of them. Yeah. So the first one is not measuring accurately. So you have your sorry, you have your blood pressure machine, which if you're working in the nature, which is the normal one, regular one. And even before you even enter your station, your test center station, you will see the one that they're going to use there, like a dummy, the one that they're going to use, the one you're going to see. And even in your practice, your practicals, you're going to be exposed to this PP machine they use. Yeah, and that's why it's very important for you to be going to work, because if you're going to work, you'll definitely be doing observations every time. You'll be doing it, so you get used to it. Yeah, so that's, by the way, to not measuring actual vitals accurately. They're not the mistakes people do, but trust me, if you're going to work, you get used to it. And that's why it's important for you to be going to work when you're praying for your Osce exams. Yeah, very important. Another thing is not not completing your what's it called, your documentation adequately or accurately. So you have your charts. When you do your observation, you have charts to fill in. You might have your news chart, and you might have your PHQ chart. You might have different charts. You might have there's so many charts basically, but the major one which they use is the news chart. Yeah, so I can't demonstrate that here, but I'm talking about basically the points. Yeah, so that's, by the way, so not charting it properly. Then again, if you're not working, you're not going to work. How do you get used to all those charts? Although if you're practicing, you might get used to it, but if you're working, you do it every day. You'll be exposed to it and you know it. That also takes us to the reason why you should be going to work while you're preparing for your Osce exam. Yeah. So another thing again is not completing the A to E assessment, which is assessment, planning, implementation, and evaluation. Not completing it, because you have different time for each of these skill session. Assessment is like 20 minutes. Yeah. Implementation, planning is writing sessions where you do your what's it called, your nursing care plan. That's what we call it back in Nigeria, but here it's called planning. So in assessment, you do observation, which is vital signs. Planning, you do your nursing care plan, the plan of what you want to do for your patient. And then implementation, where you give your drugs and medication. Evaluation is like a handover. You hand over your patients to the next nurse on duty. That's how it is. Yeah, that's the first part, which is API. Then it's the other parts, professional and evidence-based value, that basically writing. You have what's it called? You have different topics to write on. In evidence-based, you can be asked to write smoking cessation, use of honey in dressing wound, different. And then in professional-based value, you might be asked to write on or drug abuse. Might be asked to write on was so many of them. Yeah, so and also recently they have other ones they added to it. Yeah, but that's, by the way, that's another story for another day. Yeah, so we were talking about these mistakes and the points to note when writing your exams. Yeah, so we've talked about the assessment, then the planning, which is where you do your nursing care plan. So the common mistake people make during planning station is illegible writing, because planning session is basically writing. So you need to write properly, because if you don't see your writing, that's the problem for you. They might not really mark your exam. So no matter how fast you want to be, you need to make sure that you're writing what people can see. In fact, I write very slow. My writing is very slow. But when I was in my exam, I make sure that I was writing very big, so you don't see that you don't see it. So anything that's going to cause you an issue in your exam, just try and avoid it. If you don't have a small writing, learn how to write boldly. That way you don't have any issues, because you might have a point, you might have your plan, you might have everything you want to write, but then you're writing will not come out for your hand here. So make sure that you're writing very bold. Make sure that you're writing what people will see. So abbreviation, please don't come and put PCM and you not draw this sign like this. Don't put it. Make sure that you don't use any abbreviations. Write clearly what they're going to see. Don't use any abbreviation. If you're used to typing with abbreviation, once it's your exam period, stop it, so that way you enter your head. Because even me, all of us are used to read abbreviation, but once it's the exam period, please I beg in the name of God, don't abbreviate. Even you're texting, put it in your head. Let's say it in your head. Stop abbreviating your text. Let's see, so that you get used to it. And after your exam, then, hey, you can now go back to your abbreviating. So in nursing profession generally, when you're writing, because our documentation is what we use as an evidence in the law court. That's what we are told when we are training, when we were doing our nursing training back then in school. And it's true, because whenever a lawsuit comes up, a patient might sue you or anything, the documentation is what you use, what is used as an evidence. Because if you do something for a patient and you don't document it, it's as good as you do not do anything, basically. So you have to document. So, and also, we were told back then that when we were cancelling any, even before this Osce, when you make any error, if you want to cancel it, you don't scribble it and then, no, you just draw a line across it and then write error sign. That's how you do it in nursing. So in your exams, if you make any mistake, do not scribble on it, just draw a line across it and then write error and then sign. That's it. When doing your planning, make sure that your interventions are evidence-based. Yeah, interventions, and make sure that evidence-based intervention. I can't come and start telling you other one because we were supposed to have known that at this point. Yeah. Anyway, that's by the way. If we're done with assessment planning, so let's go back to implementation. So the one mistake people make in implementation, which is medication station, is not checking expiry date of medication. Just bring a medication, really dispenses. No, make sure that you check your expiration of medication, and as you're bringing it out, state it to your examiner that assessor, the medication is in date and is intact, yeah, before you dispense it. Yeah, so make sure that you check expiration of medication before you give. Yeah, another thing in implementation is inaccurate interpretation of the medication chart. So if you bring a medication chart, before you start dispensing the medication, you're meant to read it all through within your time. So you're not given a different time to read your medication chart. No, once you start, you're meant to read the medication chart from the front to the back, and then you now go back to start dispensing the medication. Do you understand me? So you make sure that you read it properly and interpret it properly. Do you understand? Yeah. Another thing is overdose and underdose. So when you have a medication, in the container of that medication, they write it there for you. They write the medication, the dose, and even in the chart, you write this. The dose is also there. In exam, they don't make things complicated for you. They gave this the same exact dose you see in the chart. That's the same dose you're going to see in the bottle. Do you understand me? So you make sure that you dispense the exact dose which patient is meant to take. Don't give the patient underdose. Don't give the patient overdose. Be sure you check for the medication dose of the medication before you give. Okay. The another thing again is signing medication before giving it. Very, very wrong. Before you sign, because there's space for you to sign your signature and the signature and the time and the date of the medication. So before you sign that, you make sure that you've already dispensed the medication, giving the patient before you come back to sign. Don't sign before you give medication. Yeah, so that's about implementation. Sorry, so go to evaluation. Evaluation is basically handover. Like I've said earlier, evaluation is handing over to the patient, the next staff on duty for continuity of care. So in evaluation, some mistakes people make in evaluation is not stating what is required of the person is handing over to. Because in evaluation has a different scale on its own. It has things that you are supposed to mention to the person that you're handing over to. So you not being able to mention all those things, and you have sequence. Do you understand? You have sequence of which you're meant to hand over. So everything has sequence in this Osce exam. So you need to follow that sequence. You need to mention every detail that you're supposed to mention. Another thing is not stating a realistic plan of action in your evaluation. Okay, so you have a patient, you're handing over, and then you have something that you're recommending for them to do, which is the last part of your evaluation. And then you're now saying something that is not realistic. Something that cannot achieve. Maybe the patient has a fracture. You're not saying the patient will recover within 1 day. It's not realistic. I'm saying fracture because I'm working in trauma orthopedic ward. That's what I'm using as an example. Have other different examples. That thing is not realistic. The patient has a temperature of 38.5 degree, and you're giving the patient paracetamol. While you're saying you're saying your action, and you're having an action which is we're using the patient's temperature within 2 hours. That is realistic. You can do that, or even providing what's it called, exposing the patient. Do you understand? That is realistic. It can happen. That can happen. The temperature can reduce within that hour. Yeah, but fracture healing within 1 day is not realistic. Except it's magic. Except it's miracle. Yeah. Yeah. Is unclear verbal communication, because handover is basically verbal. It's not written. Although you have a few times to write what you want to write, you have a time. But it's all within that your time, and it's counting for you. You have few minutes to write what you want to hand over, and then you have few minutes to also say it. So evaluation is basically talking. So inappropriate verbal communication is what fail most people. Do you understand? So whatever you're saying, make sure that is within the NFC guideline. Yeah. So, and also keep it simple. Don't come and start saying something that is too bogus or it's too fake. Keep it simple. That's one thing that really helps me in my exam. Keep it simple. Find the simplest word. Don't go and start looking for big grammar to speak. Keep it as simple as possible. Don't be impressing anybody. They don't even want to be impressed. But I've seen different students that have seen different type of students. You don't be the first person. So keep it simple. You're just testing your skill. It's not for you to come and show yourself. Don't give you, even if you're not going to have 100 over 100, not going to give you a word that you're speaking grammar, you're blowing grammar. No, keep it simple as possible. Okay. The last one for evaluation is just like I said before. Evaluation have a procedure. It has steps. It has structure. So if you need to follow the structure of evaluation, yeah. If you don't follow the structure of evaluation, maybe you start from a recommendation, which is the last one, and then you now go back to assessment, and you now go back to medical records, you now go back to nursing assessment. No, it needs to be systematically. Okay, that's about the API station. I've talked about API station. I've talked about the evaluation and professional based value, and then the other part, which is the clinical stations. I've already talked about these cues and the mistakes that people make, and then things that you should avoid in the clinical stations. Yeah, so with these things, I hope that I'm able to clear your doubts, or I hope these few things I've said, all these long things I've said, now I've spent like 15 minutes on this. I hope that these things I've said will help you or guide you through your Osce exams, and I wish you the best of luck through your Osce exams, and I can't wait to welcome you to profession. Okay, so you be sure that you prepare yourself, be sure that you practice and continue practicing. Do not stop practicing. Okay, make sure that every day you practice. And then what we were told when we were preparing for exams, that in the professional based values and evidence based values, do not repeat. Repetition is not allowed. Make sure that you rephrase it in your own words. Make it simple. Yeah, make it simple, and then know it. Yeah. Okay, and also that's about that. Make sure that your station is clear. It's safe for you to enter. Before you enter, don't forget your hand hygiene. Very important, to hand hygiene. And also your donning and your doffing, which is basically wearing your apron and removing your apron. Make sure that you always keep all the guidelines. Everything you're doing in your exam, in all your doings in your exam, don't go and do pass yourself. Please, I'm begging you in God's name. Do not do pass yourself. Do not do pass yourself. Even if you know it, you feel like you know it. Even if you feel like, oh, you know everything, please calm down, sister, calm down. Don't go and do more than you're supposed to do. Just calm down. Keep it simple. Make sure whatever you are doing is within the NMC guideline. And if you follow all these steps, and minimal, which is available on the platform of your registration, your center, I'm sure you're going to pass your exams. Okay, I wish you good luck. And if you have any other questions, why am I clapping? Oh god. If you have any other questions, ask me. Kindly drop it in the comment section and I'll be sure to answer it. If all of this I've said you're still not clear, be sure to ask me any question that you have. And if there's anything you want me to do, be sure to put it in the comment section and I'll do a vlog on that. Okay, thank you for watching and see you next in my next video. Bye.